the great thing about healthcare, which I love explaining to people, is that it's so organized and regulated, right? That you unless you're willing to completely go rogue, right? Just let's say, which obviously people do in any industry, like Wirecard or whatever it is. I mean, people can go off the hook, right? You're dealing with generally a group of people that are absolutely dedicated to delivering a quality, safe product or service from the top of the system right the way down to the bottom. Like you're not dealing with people that are necessarily motivated by money or things like that. There's always a central mission generally with entrepreneurs or entrepreneurial people in this space that sort of transcends what the commercial thing is. So like for us, it's about access to testing, whether it's cardiovascular disease or HbA1c or the work that we're doing, the Gates Foundation on polio. Like that's our bag, but everyone else has their own thing. Like for example, Ahmed at Locum's Nest, I remember talking to him, and we can talk about that for a little bit because I love that company and I love what they've done. I mean, the thing that blew me away when he came on the show for the second time was this idea that you've got NHS Trust Oxfordshire, NHS Trust Buckinghamshire, right? Like next to each other, neighbours.
Yes.
But and you've got people that will work in the Oxfordshire Trust but live in Buckinghamshire and vice versa.
Yes.
But they can't actually switch between the two trusts. They can't take shifts at the two trusts. I thought he was winding me up when he said that. I was like, that can't be true. That just can't be true in this day and age, right?
Yeah. No, but that's the thing. I mean, there is, because, to your point, because there's so much regulation, right? And there's just ways that people are used to working, which creates so much inefficiency, and where technology is just the answer, right? And but even then, it still takes a lot of time. I mean, Ahmed, you're absolutely right. It's a fantastic company. Of course, I'd say that is part of our portfolio. But it's a fantastic job really trying to break that. And I think now they're quite successful in doing so, and they're really helping to address an efficiency problem which exists because you've got a highly regulated industry, and and people working their ways and that sort of thing. So I think you're absolutely right. I think the technology really is the answer, and that's where where the system has to develop. But going back to the why the NHS is more advanced in other countries, I mean certainly in Europe, is because of that those supply constraints. Because if you've got overcapacity, none of this sort of surfaces really. But if you have undercapacity, it surfaces very, very quickly. Then all of a sudden you've got your queues in the A&E just lining up, and that is just something nobody really wants, right? Politicians, not, and it's dreadful for patients and their health, and so. But that's why I think the NHS is much quicker at adopting technology, and by doing so, you're actually catapulting yourself into the future. Because hopefully at one point we'll be in a situation where actually capacity will match demand, or supply will match demand. But then we'll have actually a system and solutions which are really enjoyable, where you don't have to go to the doctors if you don't want to. You just basically get sent your test kits like you do,